Your heart is the engine that keeps you going, pumping over 2,000 gallons of blood every single day to nourish your body. But what if something as routine as taking a painkiller, an antidepressant, or even a simple decongestant was silently putting your heart at risk? Every year, over 800,000 people suffer a heart attack in the US alone, and what's even more alarming is that certain widely used medications, ones millions rely on daily, could be increasing that risk without warning. These drugs, often prescribed or sold over the counter, may raise blood pressure, trigger blood clots, disrupt heart rhythms, or weaken heart function, leading to potentially life-threatening consequences. In today's video, we'll uncover 8 common medications that research has linked to heart risks, ones that may be affecting your cardiovascular health without you realizing it. But don't worry, we won't just leave you with bad news. We'll also share practical tips and safer alternatives to help you protect your heart while managing your health needs. Your well-being is in your hands, so stay informed, stay proactive, and let's dive into the facts that could save your heart and your life. 1. Some heartburn medications, PPIs. Proton pump inhibitors, PPIs, such as omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid, are commonly used to treat acid reflux, GERD, and ulcers by reducing stomach acid production. While effective in alleviating symptoms of heartburn and acid-related disorders, long-term use of PPIs has been linked to an increased risk of heart attacks and other cardiovascular issues. A Stanford University study analyzing the medical records of over 3 million people found that PPI users had a 16 to 21% higher risk of heart attacks, even in individuals without prior heart disease. Researchers believe this increased risk is due to PPIs reducing nitric oxide production, which is essential for keeping blood vessels flexible and open. Lower nitric oxide levels can lead to arterial stiffness, higher blood pressure, and a greater likelihood of blood clots, all of which contribute to heart attacks. In addition to cardiovascular risks, PPIs have been associated with magnesium deficiencies, which can cause irregular heart rhythms, arrhythmias, muscle weakness, and fatigue. Magnesium plays a crucial role in maintaining normal heart function, and long-term PPI use may deplete the body's magnesium stores, increasing the risk of life-threatening heart arrhythmias. To minimize these risks, PPIs should be used at the lowest effective dose for the shortest duration necessary. Alternative treatments such as H2 blockers, e.g., famotidine, dietary modifications, and natural remedies like ginger, aloe vera, and probiotics can help manage acid reflux symptoms while reducing cardiovascular risks. For those requiring long-term acid suppression therapy, regular medical checkups and monitoring for potential side effects are essential to ensure heart health is not compromised. 2. Testosterone and anabolic steroids. Testosterone therapy and anabolic steroids are often used to boost muscle growth, enhance athletic performance, or treat low testosterone levels. While these substances can improve strength and energy, they also come with serious risks to heart health. A 2017 study published in JAMA Internal Medicine found that men who started testosterone therapy had a 30% increased risk of heart attacks and strokes within the first 3 months of use. This increased risk is attributed to testosterone's effect on red blood cell production, which thickens the blood and raises the likelihood of blood clots forming. Higher red blood cell counts can cause increased blood viscosity, making it harder for blood to flow smoothly, ultimately heightening the risk of heart attacks and strokes. Anabolic steroids, often abused by bodybuilders and athletes, pose an even greater danger to cardiovascular health. These substances significantly alter lipid profiles by lowering HDL, good cholesterol, and raising LDL, bad cholesterol, which contributes to artery blockages and atherosclerosis. Prolonged steroid use has been linked to left ventricular hypertrophy, a condition in which the walls of the heart's left ventricle thicken, reducing the heart's ability to pump blood effectively. Studies have also shown that anabolic steroid abuse is associated with an increased risk of sudden cardiac death, even in young athletes with no prior heart conditions. To minimize risks, testosterone therapy should only be used under medical supervision, with regular monitoring of heart health and blood parameters. Safer, natural ways to boost testosterone levels include strength training, consuming healthy fats, getting adequate sleep, and maintaining a balanced diet rich in zinc, vitamin D, and magnesium. 3. Some chemotherapy drugs. While chemotherapy is essential for treating cancer, some drugs can have serious side effects on the heart. Certain chemotherapy agents, especially anthracyclines like doxorubicin, adriamycin, and fluorouracil, 5-FU, have been linked to cardiotoxicity, which can weaken the heart muscle and increase the risk of heart attacks. Doxorubicin, a widely used chemotherapy drug, is particularly known for its potential to cause heart failure. A study published in JACC, Cardio-Oncology found that doxorubicin can lead to heart failure in up to 26% of patients, especially at high doses or with prolonged use. This drug damages heart cells by generating free radicals, which cause oxidative stress, inflammation, and scarring in heart tissue, ultimately leading to weakened cardiac function. Fluorouracil, 5-FU, another commonly used chemotherapy drug, is associated with coronary artery spasms, which can reduce blood flow to the heart and trigger chest pain or heart attacks. Some patients undergoing treatment with 5-FU experience angina-like symptoms, including tightness in the chest, shortness of breath, and irregular heartbeats. In individuals with pre-existing cardiovascular conditions, these side effects can be more severe, increasing the likelihood of major cardiac events. To mitigate risks, oncologists may closely monitor heart function through echocardiograms and other cardiac tests during chemotherapy. In some cases, medications like dexrazoxane may be prescribed to help protect the heart from damage caused by anthracyclines. Maintaining a heart-healthy lifestyle, avoiding smoking, and engaging in moderate exercise can also help reduce cardiovascular risks during cancer treatment. 4. Diabetes medications. Certain diabetes medications, particularly older drugs in the thiazolidinedione (TZD) class, have been linked to an increased risk of heart attacks and other cardiovascular issues. One of the most well-known examples is rosiglitazone, Avandia, which was widely prescribed to help control blood sugar levels in people with type 2 diabetes. However, a landmark 2007 study published in the New England Journal of Medicine found that rosiglitazone was associated with a 43% increased risk of heart attacks and a 64% higher risk of cardiovascular death. Due to these findings, the FDA restricted its use in 2010, though some limitations were later lifted. The problem with these medications lies in how they affect the heart. TZDs can cause fluid retention, leading to swelling, increased blood pressure, and extra strain on the heart. Over time, this can worsen heart failure or trigger cardiac events in high-risk individuals. If you're taking rosiglitazone or other high-risk diabetes medications, talk to your doctor about alternatives. Metformin, SGLT2 inhibitors, and GLP-1 receptor agonists have been shown to be safer for the heart. Additionally, lifestyle changes like a balanced diet and regular exercise can improve blood sugar control while reducing cardiovascular risks. 5. Calcium channel blockers, CCBs. Calcium channel blockers, CCBs, are commonly prescribed to treat high blood pressure, chest pain, angina, and certain heart rhythm disorders. Popular CCBs include amlodipine, Norvasc, diltiazem, and verapamil. These medications work by relaxing blood vessels and reducing the heart's workload, which helps lower blood pressure. However, studies have linked some calcium channel blockers to an increased risk of heart attack and heart failure, especially in high doses or prolonged use. A study published in Circulation found that certain CCBs, particularly short-acting ones, were associated with a 25% increased risk of heart attack in some patients. These drugs can lead to fluid retention, which may worsen heart failure and cause low blood pressure, leading to dizziness or fainting. Additionally, some CCBs may interfere with heart rhythms, potentially increasing the risk of arrhythmia in susceptible individuals. People with pre-existing heart disease, low blood pressure, or a history of heart failure should be especially cautious. If you're taking a calcium channel blocker, monitor for side effects like swelling, dizziness, or irregular heartbeat. Discuss with your doctor whether alternative blood pressure medications such as ACE inhibitors or beta blockers might be a safer option for you. 6. Some antidepressants, SSRIs and SNRIs. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are widely prescribed for depression and anxiety. Common SSRIs include fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, while SNRIs include venlafaxine, Effexor, and duloxetine, Cymbalta. These medications work by increasing serotonin and norepinephrine levels in the brain, improving mood and emotional stability. However, research suggests that SSRIs and SNRIs may increase the risk of heart-related issues, particularly in individuals with pre-existing cardiovascular conditions. A 2018 study published in JAMA Psychiatry found that SSRIs could lead to an increased risk of abnormal heart rhythms, blood clot formation, and higher blood pressure. Additionally, these medications can reduce platelet aggregation, meaning blood doesn't clot as effectively, which might raise the risk of bleeding-related complications, including hemorrhagic stroke. The risk is more pronounced in older adults and those with heart disease, high blood pressure, or a history of stroke. While the benefits of antidepressants often outweigh the risks, caution is necessary if you have heart concerns. Talk to your doctor about alternative treatments such as cognitive behavioral therapy, CBT, lifestyle changes, and exercise, which can naturally boost serotonin levels. Never stop antidepressants abruptly, gradual tapering is essential. 7. NSAIDs painkillers. NSAIDs like ibuprofen, Advil, Motrin, and naproxen, Aleve, are widely used to relieve pain, inflammation, and fever. However, research has linked long-term and even short-term use of NSAIDs to an increased risk of heart attack. A 2017 study published in the British Medical Journal, BMJ, found that taking NSAIDs for as little as 1 week could raise the risk of a heart attack by 20 to 50%, depending on the dosage. NSAIDs can cause cardiovascular issues by affecting prostaglandins, hormone-like substances that regulate blood vessel function. These drugs can lead to fluid retention, increased blood pressure, and arterial constriction, making the heart work harder. Over time, this strain increases the likelihood of blood clots, which can trigger a heart attack or stroke. The risk is particularly high for individuals with pre-existing heart conditions, high blood pressure, or a history of heart disease. Even those without heart problems should be cautious with frequent NSAID use. To reduce risks, use the lowest possible dose for the shortest duration. If you need pain relief frequently, consider alternatives like acetaminophen, Tylenol, physical therapy, or anti-inflammatory foods such as turmeric and ginger. Always consult a doctor before prolonged NSAID use. 8. Decongestants. Decongestants like pseudoephedrine, Sudafed, and phenylephrine, found in many over-the-counter cold and flu medications, are commonly used to relieve nasal congestion. They work by constricting blood vessels in the nasal passages, reducing swelling and making it easier to breathe. However, these same effects can pose serious risks to heart health. A study published in the American Journal of Medicine found that pseudoephedrine use can significantly raise blood pressure and the risk of heart attacks, especially in people with hypertension, heart disease, or a history of stroke. These medications can also trigger irregular heart rhythms, arrhythmias, and may lead to chest pain or palpitations in sensitive individuals. The risks are even higher for those who consume caffeine, smoke, or take other medications that affect blood pressure. In rare cases, excessive use of decongestants has been linked to sudden cardiac events in people with underlying heart conditions. If you have high blood pressure or heart disease, avoid decongestants and opt for natural remedies like steam inhalation, saline nasal sprays, or antihistamines if allergies are a factor. Always check labels and consult your doctor before using these medications. Your heart is your most vital organ, and protecting it starts with making informed choices. While these medications can be essential for managing health conditions, it's crucial to understand their hidden risks and take proactive steps to safeguard your heart. Always consult your doctor before starting or stopping any medication, and explore safer alternatives when possible. Small changes can make a big difference in your long-term heart health. At Healthy Care, we're dedicated to bringing you the latest, science-backed health insights to help you live better and longer. If you found this video helpful, give it a thumbs up, share it with those who need it, and don't forget to subscribe for more expert health tips. Stay informed, stay healthy, and we'll see you in the next video.